It was spring 1969, full of promise. I had been working in the town library for a year in the overdue department. Spring would mark 3 graduations in the family: Steve from college, Tom from high school, and Bill from junior high. Charlie and I felt as though we were getting the diplomas, and there were still 4 more to follow. I don't know, is it there? Here we come. There they are. I knew they were somewhere. It was Monday. I was at work in the library when the telephone call came from St. Louis. Steve was in hospital undergoing emergency open-heart surgery. Time was suspended as I heard the college doctor ask if I knew that Steve had Marfan syndrome. He, a bit incredulous that I didn't even know the term. This is in 1969. Steve did not survive surgery. When we arrived, he's, of course, the tallest one there in the back. When we arrived, he had suffered irreparable damage from a ruptured aneurysm. Thus began a journey of overcoming loss through advocacy. Those were heady times for those of us looking to work with rare disease groups. So much was needed and so little known on all levels that we in the support group community were watching each other to see just what we could do with little experience and money. In the picture you can see the 2 ones, I think they'd be on your right. They have Marfan syndrome. Those are my boys, except for the middle one, who was a cousin. And they kind of demonstrate the little short, stocky ones and the tall, skinny ones, which, of course, we didn't know the implications of that at the time. The National Organization of Rare Disease was founded during these years, and the National Marfan Foundation, founded in 1981, became a member. As the new director, I attended any meeting that mentioned rare disease, which we thought, of course, meant nobody would know about it. Early on, I was on a panel for genetic disorders in New York. While eagerly awaiting the time to tell my story, the panelist before me spoke, saying, "I'm probably the only one who wishes she were not here," referring to the tragedy in her family that had compelled her into advocacy. It gave me pause. Why was I here? I firmly believe in advocacy and believe that it is an American characteristic like public libraries and schools, and a partnership between government, the patient's experience, and the researcher on the bench. This emerging partnership was what gave meaning to testimony, helping to heal our broken hearts in those days when there seemed no recourse. It was at this time that NIAMS was formed. And you can see our wonderful booklet there that NIAMS puts out, and we love. It was at this time. It was a perfect time and place for the Marfan organization to appeal for support and research. As a librarian, I knew collaboration was the key to effective advocacy, and when it came to research, the National Institutes of Health was where it was at. So when NIAMS was founded, it addressed many of the multi-system diseases. Before NIAMS, there seemed no home for these connective tissue disorders which affected the entire body in some way. It was then that I met Dr. Schulman, the director, and the NMF was one of the beneficiaries of his kind support during those early years. I can't think of a more compelling example of the role of government than in the American healthcare field. John Mortimer's wonderful barrister and longtime series on television, Rumpole of the Bailey, refers to the golden thread of English law. Here we can look at the golden threads of American healthcare: research, patient advocacy, and the National Institutes of Health. You might think of this as the 3-legged stool of healthcare: the Congress, research and its medical institutions, and the key, the patient organizations. Thus, at NIAMS began the collaboration between several organizations of these heritable disorders of connective tissue, so clearly defined by Dr. Victor McCusick. I fondly remember the coalition founding. There's a picture of it there with Tom Harkin. Meg Caulfield in the wheelchair, of osteogenesis imperfecta. This little woman of small stature, perhaps in her late 60s, with wheelchair, commitment, and courage. Too many to name, yet still many involved. The NIAMS initiated 3 symposia over the next 15 years, bringing these rare disorders together, providing collaboration between researchers in novel scientific approaches. This, as well as providing written materials for researcher and layperson when you consider there wasn't anything in 1969 when my son died to explain what Marfan syndrome was. The nosology of 86, now revised with Marfan characteristics ranked. I've missed. In 1990, the Marfan gene was identified as well as fibrillin. I forgot the most important line here. We who benefit share the same bond of friendship with those who administer NIAMS programs, and I always fondly appreciate that support. In 1990, the Marfan gene was identified as well as fibrillin. Diagnosis improved. The nosology of 86, now revised with Marfan characteristics, ranked. Surgery made possible through the heart-lung machine greatly improved over the years with amazing options. New potential therapies explored. The 77 clinical trial in which my son John, who's somewhere around here, participated. Now the promising losartan trial in which his daughter Danica is enrolled. A NIAMS P01 grant was initiated several years ago by 4 researchers, Drs. Lynn Sakai, Hal Dietz, Francesco Ramirez, and Daniel Rifkin. Central to the hypothesis was reviewing the role of microfibrils in regulating the activity of TGF-beta superfamily signaling molecules. This is a new term in our lexicon, TGF-beta. It is rare in science that 4 investigators can come together around a common theme, each with a unique contribution to a common end, and that end perceived as potentially yielding a clinical contribution. It is clear that what is learned from a rare condition can have wide applicability. The journey of our family, as you can see, the 3 on the top, has been mirrored that of Marfan research, which is interesting. It's over 40 years now. Although we weren't able to protect Steve in those early years, others have been able to benefit from increased knowledge. Charlie to undergo several open-heart surgeries during his lifetime. Son Peter, open-heart surgeries and an apparent Coumadin-related stroke. John, the youngest, open-heart surgery, later a pacemaker. Their lives extended through lessons learned from research and experience. We grieve that my grandson, Peter's son Oakley, died from an arrhythmic incident following surgery. But 2 granddaughters are here and flourishing. There is much, you can see them down there. There is much for which to be grateful. We as a family and as advocacy and patient groups have actually experienced the benefits of NIAMS-supported research. We derive hope from this, which is a necessity in our lives. Thank you very much.